Welcome everybody. This is a video that I'm very excited about recording today. I have a guest here to introduce to you. Her name is Fiona Singleton. I am in Toronto, Canada, and she's on the other side of the Atlantic. She is in the United Kingdom, and I met Fiona via social media. I never met her in person. Unfortunately, maybe one day, Fiona. And I'm very happy that she agreed to talk to us today because her experience with chronic pain is fantastic. She's a very young lady, but she has a lot of experience. She had chronic pain for almost 25 years. And she will tell the story, what kind of pain she had, the diagnosis she had. And then for the past 4.5 years, she is practically pain-free, and she uses a lot of the techniques that I tell you in my videos. You know, when I talk to you about central sensitization, fibromyalgia, chronic fatigue syndrome, fatigue, and I tell you, this is all central sensitization. This is all the malfunction of the pain system, and you do need to retrain your pain system. And some people write comments to me on my channel asking, how do you do this, Dr. Furlan? What is this retraining of the pain system? So I brought here to you today a teacher because she has done this for herself. Now she's, spreading this news to a lot of other people. She wants to spread the news that helped her. So we are here to hear from you, Fiona. What does it mean to retrain the pain system? And it's amazing that even after 25 years in pain, fatigue, the brain is so plastic that people can do it. There's no age. I tell people, you are never too old. It's never too late to start rewiring your pain system. So Fiona, you are our teacher today. I'd like you to introduce yourself, tell us a little bit about who you are, what do you like to do, and then tell us about your story. Tell us about your diagnosis of pain.
Yeah, well, thank you very much for having me today. So I live in the United Kingdom, as you said, and I first developed pain when I was 25 years ago. So when I was 11 years old. And I actually also had a diagnosis of ME and fibromyalgia, so chronic fatigue syndrome, which I then had symptoms of that for 14 years. And so now who I am is somebody who loves studying. I love hiking. I love going to dance classes and swimming and all sorts of lovely active things. But I couldn't do that for the majority of the 25 years of the symptoms that I had. And I'm now studying health psychology because of my recovery. It's something that I'm really interested in. But yes, I basically, my pain started, I had a fall from a horse actually when I was 10 years old, and over about 6 months after that, I was in pain on and off. And it kept going away, but then there came a day where it stuck around, and it became chronic from that point. So really from the age of 11, I was in and out of hospitals and dealing with lots of different symptoms until I discovered brain retraining and was lucky enough to recover completely. So yeah.
Amazing, amazing. So so I would consider you like a person that has conquered chronic pain, and it's amazing. And can you tell us all about a little bit about the diagnosis that you had? What did the doctors tell you that you had? Did you have investigations? Like, did they try to, find problems, and did you try medications for your pain before you went to this pain retraining, brain retraining?
Yes. So obviously, having had 25 years of symptoms, I had a lot of different investigations, a lot of different medications, different diagnoses. The first diagnosis I had was, at the time, it was reflex sympathetic dystrophy, which is now known as CRPS. But over the years, I had diagnoses like just chronic pain syndrome, fibromyalgia was brought in. I have a diagnosis of EDS, Ehlers-Danlos syndrome. Obviously, the ME diagnosis. I also had a diagnosis of POTS, so I had heart rate issues for a bit. And medications, I mean, I was in and out of hospital from the age of 11. They tried me, they got me into these pain management treatment programs, and alongside physiotherapy and hydrotherapy and sessions with occupational therapy, I was on all sorts of medications, anything and everything. I tried codeine, tramadol. I was put on, I think it was a stage where they tried me on things like Oromorph. I had a prescription of oxycodone at one point, which I didn't actually take because it felt a step too far to sort of go down that road. But I was tried on everything, and very little brought me any relief. So I think there came a point where I wasn't really on anything because I was just trying to manage on my own. But certainly I had lots of interventions, went through pain clinics and had sort of epidurals and nerve blocks, and had a facet joint denervation done. Actually had that done twice. So lots and lots of different attempts at treating it, and trying from different angles, different doctors and different specialists, and to try and get to the bottom of it. And nothing helped with the pain in terms of going to the doctor and getting care from the doctors. It was very severe pain at times, and very little relief from anything.
Wow. Yeah. I see a lot of people that I'm trying all of those things that you mentioned.
Yeah.
And they get a little bit of better, for a few days, maybe a few weeks, but then the pain comes back. Did you also have psychology, psychotherapy, counseling, those kind of things that we
I
recommend?
did, and I mean, initially it was very much something that I didn't have a lot of choice in, because I was a teenager and I was going through these pain management programs, and so it was part of the deal. And I didn't have a good experience of them. I always felt like I wasn't believed, and that the pain wasn't taken seriously. And then as an adult, I sort of I tried these things more because I'd chosen to do them, and wanted to see if they would help. And nothing really. I mean, I think here and there, sort of, I in across the 25 years, I had good years and bad years, and I can look back and say, well, maybe this helped for a bit or that helped for a bit. And certainly looking at sort of pacing and making sure I was sleeping well, and paying attention to my diet, bits of help around that were helpful, but overall nothing got rid of it.
Okay. Okay. So I think we're all excited to hear about what did work. Can you tell us then, what did you do? What does it mean, this brain retraining? Because I know there are many different techniques, many different ways of doing this. It's not new. This is not something that is new. There are some new names now, and I mentioned those. I have in my book, The 8 Steps to Conquer Chronic Pain. I have the first step is brain retraining, is rewiring your pain system. And I do mention a lot of different techniques. So I want to know from you, what did work for you? How do you tell us in practice? How do you do this, in very concrete terms?
I think it's one of those things. It's quite hard to explain, in the sense that they sound very simple techniques. And I know when I came to brain retraining, and this was something that I stumbled on, so I didn't think there was a cure out there for me, and I didn't think there was really anything that was going to make any kind of a difference. And I got really desperate, so I was sort of looking around for things. And when I started brain retraining, I think that my first instinct was, well, is this just meditation? Is this just relaxation? And I've tried all of that, and even things like journaling is one of the key techniques, I think. But I would have said, well, what's that going to do? My pain is so severe, and my fatigue was really bad, and I think it's very easy to look at it and get the wrong idea that it's sort of not going to help you, that it's very simple. But I think that brain retraining for me, why it worked, is because it was a new approach in terms of having some pain science broken down for me as the first step. And I think that having that understanding of why you're doing brain retraining is everything. Because if you can understand that for lots of people, pain there isn't really anything wrong with your body, and it's your nervous system that is maybe trying to express some fear or another emotion, and actually all the exercises you're doing are trying to calm your nervous system down and trying to reassure yourself that you're safe. And that's where, for me, the difference that this time that it worked, because I suddenly had an understanding of what I was trying to achieve. And I think that there's different exercises which I think different ones work for different people, and it's worth trying them all. And some of it for me was meditation, some of it was journaling, and journaling is a way of kind of expressing your feelings and being in touch with your feelings, so that the nervous system can be calm, rather than having to alert you to the fact that it's not okay. I think that one of the exercises that helped me was somatic tracking, and I think that's a really fantastic, very simple exercise, it's based in mindfulness, and it's about paying attention to your symptoms, but really observing, just as it comes up, maybe the pain that sits there, and watching it. Sometimes it sort of starts jumping around the body a bit, and but it's a kind of, it works as a combination of exercises, really, and it's all rooted in making your nervous system feel safe. And I think that I added in as well some visualization. So again, this is something that, across all the years of being in pain, if you said to me, well, you've got to do some visualizations, I would have said, well, that's not going to help me. But actually I use them, and I think the key was using them and repeating them over and over in the day, and it would just be lying in bed and imagining myself getting up and being able to move without any symptoms, or maybe being able to get on a bike and ride the bike and feeling well, and seeing myself as a healthy, happy person. And I think it's the repetition of doing that. It almost feels like you're taking yourself by the hand and leading yourself in the direction you want to go. So you're showing your brain, this is what I want to be. And I think it sounds like it's never going to help people when you come across these ideas. But if you can get a good understanding of what pain is and what symptoms can be, and how they are your nervous system expressing the fact that it's not okay, it all starts to fit into place and starts to bring about changes with symptoms.
Yeah, this is so important, because what you were explaining here is basically neuroplasticity.
Mm-hmm.
And neuroplasticity means creating new synapses.
Yes.
In the brain. And when you create new synapses, the other ones that are not so helpful, they start getting disconnected. You can undo synapses. You cannot actually unlearn a lot of things once they create synapses. We think that they are created forever, but you can make them weaker. And we can see this in laboratory, right? We can see this in images, the synapses get weaker and weaker. And then if you make the other ones stronger. So I love your idea of visualization, because this is something that a lot of people don't do. And they don't believe. I think believing that it works is the key step here. Because if they don't believe it works, they will never try. I have patients that they tell me, no, I'm not going to try this because this is so simple. And this is But when you do visualization, and we do this with people who had amputations. Yeah. So people who had amputations, let's say that they amputated a arm or a hand, they don't have that hand anymore, but their brain is basically saying, where is the sensation coming from that arm? Because those cells in the brain responsible for getting that sensation are still there. So if the hand is not sending impulses to the brain will create sensations, fake sensations, phantom sensations. And we call this phantom limb sensations, phantom limb pain. So people can even have pain in an amputated arm. And what you are doing is basically therapy, those visualizations. So if you can imagine you getting out of the bed, going out in the nature, and go shopping, you are creating those synapses in your brain, and now your brain is primed to do those things. This is extremely important. I'm glad that you mentioned that. Anything else that you want to mention about the process? How long I know it took very short time for you, which is surprising. I know some people say, no, that cannot be true. I know some people take longer than that, and not everyone will take so short as you, but can you tell us how long did it take, and what were the first steps that you started taking when you started seeing some results? What were the first things that you noticed that this was working?
Well, I think I mean, it's really interesting to touch on the time it took, because I am in touch with people that have used the same sort of brain retraining programs and have taken months to see changes. And I think everybody's on their own journey with this, and it takes the time it takes to you. For me personally, I mean, when I started this, I was really at a point of being so desperate. I knew I had to give it my all, and I had to see if this was going to make any changes for me. So I sort of cleared, not that I had very much in my diary, but I cleared my diary and I thought, I'm going to be doing these exercises multiple times a day over a few weeks, so that I'm giving myself a chance of it working. And really within it was about 3 weeks that I knew this was changing things for me. And it was about 6 weeks that I sat there and thought, well, I'm not in pain and I don't have any, because I had post-exertional malaise with the ME and that was gone. And I still, I mean, I had to build some confidence in my recovery. So it's not like I got to 6 weeks and that was it. I sort of skipped off into the sunset. I had no fitness and no strength, and I had to really, it probably took me another year or two beyond that to kind of rebuild a sense of confidence in my own body and rebuild some physical fitness. But it was 6 weeks that I sat there going, well, I know this means that I'm recovered. And actually early on, I was hardly walking really. I used a wheelchair outside of the home, and I didn't walk around that much within the home. And I remember thinking that because I was so limited, I couldn't get my heart rate up, I couldn't exercise at all, and I'd spent years avoiding doing anything that was too strenuous. So I thought, well, I have to test this. I have to make sure that this is actually right. And the first thing that I decided to do was actually just take a walk down. There was a path behind my parents' house where I was staying. And now, I mean, it's so flat, but at the time there was a little bit of a hill, and I knew that I hadn't been able to do that without crashing for a long time. So I just challenged myself to do that. And in fact, I got probably to one end and I started getting some symptoms, and I stood on that track in the middle of a field, really, sort of trying to go over the exercises I've been learning and actually trying to visualize myself looking well and being healthy, and had a sense of sort of checking in on, well, no, my arms and legs actually work and there's nothing physically wrong with my body. So I had to shut my eyes and I had to sort of talk myself through this moment. And then I was able to walk back and I was okay. And once I had given it a few days and made sure that I hadn't had any awful symptoms coming up, I went on another walk, and I did this over a few days and a few weeks where I kept challenging myself to the next level of walking. And then there was one walk in particular where I knew it was really quite a big hill, and I've actually since been back to that hill. And at the time, it was really overwhelming, and it felt like a really big, really big steep hill. But I have been back, and it was hilarious because it's really, now I've been up some mountains and yeah, I'm a lot more active, and so it feels like nothing. But at the time, that was really a big moment in saying, if I can do this, and I can physically do it, but B, I'm not going to then crash from it or have any pain coming up, then I sort of, that was my moment of going, this has worked. And I did it, and it was the most incredible moment, because I hadn't been free to walk like that for years. And yeah, just knowing at that point that I would be able to build some strength and go on to do other things. But I think there were probably many more moments like that over the year where there was a sense of, can I actually do this, and can I do this, and can I do this? And every time I tested it, it worked and it was fine. And if I did get any symptoms coming up, then I had the tools. I could sit there and I could use my exercises to kind of make the symptoms go away, which I think that's really key in those early days, that you have to be realistic about the fact that symptoms can come back, and it's then an opportunity to kind of go back to the brain retraining work, and then when you do see the symptoms go away, you get a bit more confidence every time that happens, that you're okay and that you're fit and strong and well.
Oh, amazing. I was listening to your story here, and I didn't write the book based on your story because I did not know, but that's exactly what I mentioned. And actually, the cover of the book are mountains.
Look at that.
And the steps are going up the mountain. And the first step is retrain your pain system. And what I tell at the end of the book is basically, your first mountain can be, very flat and look like very big for you, but at the end, you'll be ready to tackle
Yeah.
and conquer much bigger mountain.
Well, so you know, the amazing thing about my first mountain, and I didn't even really get right up to the top, was I mean, I have people saying to me, well, do you think you just spontaneously recovered and maybe it was a fluke? But when I recovered, I went on Facebook and I had a lot of friends with chronic health issues, and I said, just to let people know that I think I'm getting better, and these are the steps I've taken. And I have a very good friend who was very brave and said, I think this might apply to me as well, and went off and did the same brain retraining program and recovered about a month after me. And she's been an amazing person to sort of to go through this journey of recovery with. But she and we went up a mountain together, and in fact we had a very small bottle of champagne at the top, and
Oh my God.
that was
It
my
gives
first
me chills.
experience with her.
Yeah.
And it was absolutely incredible, and yeah, I will never forget that moment. But it was tough. I was very unfit still at that point, and it was a hard thing to do. So
Would be hard for me too. Yeah. So one thing that I want to ask you is about all of those diagnoses that you had. Like people
mm,
gave you diagnoses of fibromyalgia, chronic fatigue syndrome, ME, Ehlers-Danlos syndrome, POTS.
yeah.
And I do have patients that they really, they like to have those diagnoses because it gives them some legitimacy that their pain is actually real. They have something to show. And I usually tell them, I am a doctor, so I want to find a diagnosis of the pain. I love because then I can treat something, right? I can treat you. But there is usually, this is how I explain lay terms. I use the analogy of the hardware and the software. So if you have a computer that is not working, your computer stopped working, your laptop stopped working. It could be because you broke something, like the laptop fell on the floor and the hard drive broke. So that's a hardware problem. You go there and you change the hard drive and the computer works again. So that is something like a nociceptive or neuropathic pain that we know where the disease is in the body, we treat and the pain goes away, or at least it's managed. But when the problem of your computer is software, like there's nothing broken with the computer, there's no piece that you need to replace, no wire that is in short circuit, but it's just, you need to reinstall the antivirus, or you need to, close down all the windows and reopen again, or you do need to reinstall an update of a software. I usually tell people this is the malfunctioning of the pain system. There's nothing broken with your body that we can go there and inject, do surgery or medication they will not fix. It's a problem of software. But when it's a problem of software, the solution is hard to find because you need to try, like if my computer stopped working because of a software problem, I need to try first. The first technique is let's close down all the windows and restart the computer. Okay, this didn't work. Now let's try another thing. Now let's try to reinstall the antivirus. So you keep trying until you fix this software problem. I guess my patients, when they believe that they have this malfunctioning of the pain system and they need to retrain the pain system, they try one technique and they say, no, it didn't work. So it means that it's not a retraining of the pain, and they want to go back to the hardware problem. What would be your advice to some of my patients who are listening and seeing you today? You tried for 25 years, you tried to find a hardware problem that could fix your pain and you didn't.
Yeah.
And I would say you were lucky that the first attempt that you had in retraining your pain system worked. But if they don't find that the first time, just keep trying.
I think that, I mean, I'm in such a lovely position where, because I've been well now for 4.5 years, and I've spoken to so many people who've gone through brain retraining, and I think that I've seen so many people benefit from this, and lots of people who would have said originally, oh, this isn't going to work for me and I'm not sure, and my doctors found this damage in my body or whatever. But But I think sometimes you do have to be creative about looking around and maybe trying exercises that you don't want to try. Sometimes that's worth doing. Some people say, oh, I'm doing everything, but then it turns out they're not doing one exercise because they just don't think that's going to help them. And I would say just be really thorough about trying all of those different exercises. But sometimes you do need to be creative, and you do need to, there are lots of different people teaching brain retraining, and sometimes one person has a different way of explaining something, or a different set of exercises that do end up working for somebody. So keep pushing to find answers. And I mean, the teaching that I've had is that very much the majority of chronic pain, the vast majority, can be changed with brain retraining. So it's more likely that it's relevant to you than anything else. So sometimes it's about being persistent. Sometimes I think that it's about doing deeper work. I mean, I think brain retraining is very simple, and there's some very simple techniques, but sometimes it's easy. For example, if you're constantly your brain is constantly generating pain because there's a lot of fear, and there's a lot of, I mean, maybe you're somebody who's had a lot of trauma, or you've had a lot of hardships in your life. And I think that sometimes people start doing this work, and they start looking at maybe why their nervous system is sort of being triggered and is generating this pain. And it takes courage to kind of go work deeply and say, okay, actually, maybe something happened at an early point in my life that I haven't really wanted to look at, but this is the thing that's it's still sitting there, and it's still triggering that fear. And it's just, I would say, just go as deep as you can and do it safely. And obviously, some people maybe want to get some support in doing that, but you have to do the work, you have to do it properly, and you have to be brave about looking inwards at times and seeing maybe what's gone on in your life, that things, that your whole nervous system is sort of oversensitive. And I love the idea of the sort of hardware and software problem. And I was very lucky early on with my journey that it was all sort of clicking for me. But then I watched this amazing talk about how, if you've got a broken bone in your leg and you try and go for a walk, you just physically cannot put weight on that leg because the bone is broken. But if you are in a situation where some days it's terrible pain and other days it eases off a bit, or even within one day it can be really bad at one point and easier later on, there is your sign that it's a brain retraining issue. Because if it was just a broken bone, you just wouldn't have any ability to walk at any point. But you're looking to see the sort of variation over the day or over the week, and if you have that, if you see that your pain changes, then that is evidence that it's your brain generating it, and immediately you've got something to play with, and there actually is it's relevant exercises for you, basically. And so keep going and look at I was told, write an evidence list, write a list of, go back over the last month or two and look for things that you were able to do that if there was something structurally wrong, you wouldn't have been able to do. Or look at times that the brain has tripped up a little bit, and write down as many bits of evidence as you can that will show you that your brain is to blame, really. And I found that, I mean, again, it's very easy to sort of think about the things and not write them down, but if you can write them down and have them in front of you and see that actually there are times when you are managing to do certain things, or you're having moments where the pain is less, it's right there in front of you. And it's about sometimes convincing yourself as well that these things are relevant. So it's very powerful. It's a really good thing to go and do that, I think.
I love that. Yeah. I am on a mission, Fiona, to help healthcare professionals to learn about this.
Yeah.
I think the medical profession are too much on the biomedical model. They don't see the other part of the person.
Mm-hmm.
And also in the mental health profession, I see a lot of professionals who do counseling, therapy, psychotherapy, but they never heard about nociplastic pain. They never heard about the mind-body connection. Of course, not all chronic pains are nociplastic, like yours was. There are pains that are mixed. They can be nociceptive, neuropathic, nociplastic. All three. I have patients that they have all three types of pain. I think we need better to better train the medical profession to diagnose, the 3 types of pain. But the problem is a lot of my colleagues are not even thinking of the nociplastic component when it exists there. So what is next for you? What are your next steps in this journey in your trying to help other people with chronic pain? I know you also have a big presence on social media and trying to educate and spread the message of what helped you. But so what is next for you, and how we can amplify your reach with this video?
I think it's a little difficult to answer because I think I'm still figuring out how to spread the word. I feel really passionately about, if I had had brain retraining, just education around the kind of exercises available. If I'd had access to that 25 years ago, I wouldn't have suffered actually as much as I did. And I did suffer. I had a very, very bad time with pain at times, and the ME as well. It was difficult. And so I feel really strongly that I want to spread the word about this, so that not that it's relevant to all pain, and it's some people get a complete cure and some people get an improvement. So try and be balanced about the message that I'm sharing, but yeah, I want to share it enough that people are able to access these techniques early on in their pain journey if possible, so that they don't go through so many years of symptoms. And I think that when I finish my master's degree, I would love to be making some more YouTube content, so that if you go to the doctor and you've got questions about these techniques, you can actually hear from another patient who's used these ideas. And I've got some articles I want to write, but I think at the moment, I'm very interested in becoming a psychologist and helping people that way. So I think there's a bit of a long journey ahead of me to get to that point, but I'm going to see what I can do with that. But yeah, I think I'm just giving talks in person as well, and I love that. And just, I think, trying to chip away at sort of, as you say, there's lots of doctors who don't know about this at the moment, and they're very worried about being perceived as telling patients that the pain isn't real, which actually none of these exercises are saying that at all. If you are in pain, then you deserve to be believed and supported. And actually, I always try and say that it's something that the brains generate pain to sort of protect us, and it's a normal human thing, and it's absolutely, you should always be believed if you're saying that you're in pain. So educating, I guess, medical professionals about how to have these conversations, and knowing what resources are out there is a really big part of what I want to do. But I think it's taking it a step at a time, and yeah, seeing what opportunities come up as well.
Oh, fantastic. Where people can find you on social media? I'll put the links in the description of this video below, but where do you want them to find you?
So I've got my Twitter account at the moment, which is a lovely way of I've had all sorts of contacts with people through that, and that's at Fiona's Story with an underscore in between the words. And then yes, I will be developing some YouTube content, but that's still to come. But and I'm also I'm looking at Medium to print some articles and get the word out that way. So lots of things up and coming, I think.
I'm pretty sure there will be lots of comments. Please write your questions to Fiona or myself in the comments below. If you have comments, questions, suggestions for future videos, please remember that this video is not to make a diagnosis of your pain. My videos are only for educational purposes. And if you think you have a condition that is causing you pain, chronic pain, fibromyalgia, ME, whatever, please talk to your healthcare professional. Maybe show this video to your healthcare professional so they can get some ideas about how to help you with your symptoms. But we are not able, neither me or Fiona, to help you personally. So don't write any comments here or questions asking for personal medical advice, because we will not be able to do that. But we are if there is any suggestion that you have about your story, if you want to share your story, your symptoms, what worked for you, please write this in the comments below. And don't forget to subscribe to this channel if you want to be, notified of future videos, if you like the content. And if you like this video, give a thumbs up here. So I'll see you in the next video. Thank you.
Thank you.